Thank you all for coming, everyone. It's great to see so many of you here. For those of you who don't know me, I'm Beth. I'm the support line nurse for WM UK, and we're really lucky to be joined by Regine this evening, who's an occupational therapist at the Royal Marsden Hospital, and she'll be sharing all her tips and advice for managing fatigue. Um, just before we get going, and I hand over to Regine, just a couple of housekeeping bits. We'll be recording this evening's talk so that we can put it on the website for those who weren't able to make it this evening. So just be aware that we are recording. Also, I'd like to ask everyone to check they're on mute. Just it's surprising how much background noise comes through even when you're not talking. So if you don't mind just checking that you are on mute. And also after Regine's finished speaking, there'll be plenty of time for questions. If you don't want to speak yourself, you can write your question in the chat box on the bottom right of the screen, and I can read out any questions that you have. So without further ado, I'll hand over to Regine.
Oh, thanks, Beth. And just let me share my screen.
Oh, brilliant. Yeah, I can see that.
Okay, so good.
Yeah, all good.
For some reason, I can't see everyone. Okay, that's fine. So, are we ready to start? Okay.
Yes, go for it.
Okay, thank you. So thanks, Beth. Good evening, everyone. Thank you for inviting me to this event. My name is Regine, therapist, practice educator, and senior occupational therapist at the Royal Marsden Hospital. And this evening, I am going to talk about fatigue management. So in today's sessions, I'm going to talk about what is cancer-related fatigue and different domains of fatigue and fatigue management strategies. Okay, so before I start, can I just have a little bit better ideas about which stage are you currently in with your treatment? So if you can scan the QR code on the screen, and it should be direct you to the questions. And if you don't have the smartphone with you at the moment, or you haven't used Slido before, please type in the chat box. So I'm just going to unshare and then move on to the Slido. A second. Okay. Right. So it's good to know. So majority is being monitored under active surveillance, and some, okay, treatment. Okay, great. It's good to know as everyone's stage are. So around 70–80% are being monitored active surveillance, and around 40% of everyone here is undergoing treatment. Can't any more now, or and like 12% recently complete treatment. Okay, that's great. Okay, I'm just gonna unshare that screen and then go back to my main slides. Okay, so thank you everyone for sharing your experience so far. So as we can see, fatigue can happen at any stage, and some people even start feeling fatigue before the diagnosis. So we're going to look at the facts of cancer-related fatigue. So it is really complicated topic, and fatigue is not just feeling tired. Around 9 out of 10 people with cancer may feel fatigue at some point. And fatigue may be temporary or it can be long-term, and it can fluctuate. Every day will be different. Fatigue can affect people in many different ways. So there's one patient told me that what fatigues feel like, and he said, I found it very difficult to have a social life. By the time I got anywhere, I was exhausted, even just sitting and talking to energy. So what is cancer-related fatigue? Cancer-related fatigue, by definition, is a persistent subjective sense of physical, emotional, and/or cognitive tiredness or exhaustion related to cancer or cancer treatment that is not proportional to recent activity and interferes with usual functioning. Cancer-related fatigue is different to everyday fatigue because it's not relieved by rest or sleep. It differs from one day to the next in how bad it is and how much it bothers you. It can be unpredictable. The symptom just just appeared, and it can be really overwhelming and make it hard for you to feel well. So what causes fatigue? And it's not fully understood yet, but it can be multifactorial. And the reason can be the cancer itself, the cancer treatment you have, for example, chemotherapy, radiotherapy, immunotherapy, targeted therapy, or hormone therapy. Or it could be anemia, not having enough red blood cell. It could be diet or nutrition-related problems. It could be because of the pain or psychological effects of cancer, for example, anxiety, depression, stress, or sleep disturbance, or maybe other underlying health conditions, for example, infection, low thyroid functions, or heart problems. Okay. So the next question I'm going to ask you, if you don't mind to scan the QR code again, and I want to know, would you mind just share in the group here, what kind of fatigue symptoms you have experienced so far? Just going back to the Slido again. Oops. This one, two. Drained. Okay, thank you. Or you can use the chat function. Drain, pain, tiredness, sound exhaustion. Yeah. Brain shutdown, migraine, exhausted, feeling faint, wash out, tiredness, trickle, general tiredness, like hitting a brick wall. I think definitely wash out. I think people cannot mention that quite a lot. Exhaustion again, elephant on chest. Oh, tired legs, unmotivated, pain. Yeah, inability to think clearly. Exhausted, exhaustion. Okay. Yeah, definitely wash out and exhaustions. Okay, I'm just gonna come up with the Slido and back to my screen again. Okay, so as we can see, so thank you for sharing your experience so far. So I think like washout, exhaustion, tiredness has been mentioned that by many of you. So now we're gonna look at the different domains of fatigue. And so fatigue can happen in many different ways. Now we're gonna look at each of them to see what kind of symptoms that can present with. So for physical fatigue, and it could be tiredness, low energy level, wanting to stay in bed, or even hard to get out of the bed. And you might want to increase more time to sleep or rest. For cognitive fatigue, it could be difficult with concentration, difficult with focusing, difficult with remember things, feeling overloaded, or difficult understand new things or learn new things. Or you might find that you are reading a book, but none of the information is taking in, or you're watching a TV or watching a films, and it just seeing black images. It just can't get any information in your brain. For sensory fatigue, it could be oversensitive to pain or feeling overstimulated by the light or the noises around you. For emotional fatigue, I think some other people mentioned about that. It can be sometimes lack of motivation or feeling frustrated or irritable and might reduce confidence and feeling out of control and feeling of you never being normal again. And for social fatigue, it could be avoiding going out, avoiding your usual activities, or seeing less of your family or friends. And you might accept fewer responsibilities or you have to reduce your work hours. For spiritual fatigue, you may start questioning yourself, why me? And changing identity, your personal identity, to feel that you reduce of self-worth and feeling that no one really understands what's happening around you. So it is important to recognize the fatigue symptoms and acknowledge that these can change from day to day, and the severity may be exacerbated by the treatment side effect as well. For example, nausea, vomiting, or medical condition like pain. Okay. Okay. So now we talk about what fatigue is, the reason what might cause fatigue, and the different domain of fatigue. So now we're going to move on to managing fatigue. So like I said earlier, fatigue is complicated and it's not a quick fix. So for medical management, if your fatigue symptom is caused by a medical reason, for example, infection, pain, or anemia, these can manage locally with your treating team. If the causes of fatigue has been treated or ruled out, and the following non-pharmacological interventions are recommended during or after your treatment. So first one is education. Many cancer charities now produce fatigue management booklet, and it's not just for yourself to understand what fatigue is, but also for your family and friends or even your employee to understand, because fatigue is really hidden symptoms. It may not be so obvious compared to someone with physical difficulties. And other intervention could be like using fatigue diary, we're going to talk about later, reviewing your rest patterns, being active, practicing anxiety and stress management strategies, maintaining good sleep hygiene. For nutrition, if you have concern with nutrition because you're not eating and drinking well because of your cancer treatment, please do speak to your treatment team if they can refer you to be seen by a dietitian for further discussion. Okay. So when talking about managing fatigue, we need to think about how you spend your energy and understand your energy levels. So there are two ways to explain, to think about your energy level. One is to think your energy level is like your saving account. So you have an energy bank. In the normal circumstances, you would like to spend your money wisely. You want to think about how you're going to spend your money, in what way. So when you trying to spend too much money in one go, you ended up having an overdraft. And when you are trying to spend your energy all at once, and what happens is your energy bank account will become overdrawn. Another way to think about your energy level is think about your energy level is like a phone battery. After having shower, your battery level might reduce to 7%. And then if you continue to do the gardening, cleaning, or any heavy duties, your battery will continue to go down to 40%. So, which means that it will take longer to recharge your battery from 40% back to 100%. So if you have a little rest after shower, for example, when your battery bank is down to 70%, and you have little rest from 70% back to 100% would be easier. But do think of not everyone woke up with 100% charged battery every day. Some might woke up with 80% to start with. So this is something to consider how you're gonna spend your day or plan your day if you doesn't have a full charge battery. So next is about the fatigue diary. So keeping a fatigue diary can be quite helpful. It's a good tool to review how your energy level throughout the day or week. So for instance, you can rate your fatigue level on the scale from 0 to 10 during afternoon, morning, afternoon, or evening. 10 indicates that you have a worse fatigue level, and 0 means no fatigue at all. So you make a note of any treatments or activities that you had at that time. For example, you might score 4 in the morning, 5 afternoon, and 7 in the evening. And you write down the treatment. Morning, I had a shower. In the afternoon, I had hospital appointment. And evening, I might just watch the films. So by doing this can help you to identify if certain activities exacerbate your fatigue symptoms or if you are overdoing things on a specific date. And you can think about, okay, maybe I need to rejuggle my days or week because I really get really fatigued the next day. So I think this is quite a good visual cue to think about how your week or day has been spent. And then you can rearrange your task. Other strategies you can use to manage fatigues, we call it 5P strategies: pacing, planning, prioritizing, positioning, and permissions. So for pacing is to think about how you balance your activity and rest. Take regular breaks in between and allow a longer time to complete a task. Just don't think about I need to push through it and stop the task before you are getting too fatigued. So this is quite important to think about when we talk about what your fatigue symptoms. When you start feeling that, okay, I think symptoms are coming up and it's a time to stop before it becomes worse. For planning, you can use a diary or a checklist to plan your day or a week ahead. Consider what times of the day are best to do certain tasks and to think of breaking the activity into small steps and mix the heavy and the light duty during the day or the week. For example, if you have a hospital appointment or treatment next Wednesday, and you might need to adjust some activity on the day to do that the day before or the day after, because hospital appointments, you might need to spend time traveling and waiting and then traveling back. So on those days, you might feel quite exhausted. So just plan ahead if you can delegate a task to someone else, or you can postpone the task to the day after. For prioritizing, you can use a list to prioritize the most important activity each date and then cutting down the unnecessary task or giving to someone else. And do remember to include the activity that you enjoy as well. For positioning, just think about the position when you do certain tasks. So usually standing consume more energy than sitting. For example, you may consider sitting on the shower stool or shower chair to have a shower if you're too tired, or sitting on the chair or edge of the bed to get dressed or get undressed. Or you can have a stool or a chair nearby when you do the cooking. So if you need to wait, you can sit down to conserve your energy and also avoid too much bending, twisting if possible. And the last P is for permissions. So we all have good days and bad days. So on those bad days, just give yourself a permission, asking for help, or even you want to take a break or rest. And just don't be too harsh for yourself. So next is some resources about using a diary to plan your day or week. And this is prioritizing tools. And so you can think of the example of making a list and they can rate the priorities. What must be done on the day and what can be postponed or delegated. So you can think about that. And do remember to include the things you enjoy doing as well. And the next one is about setting goals. So setting small and achievable goals is also important. So this table can help you to plan what you really like to do, anything you enjoy most and you want to get back to, and then you can break down the task into 3, 4 small steps. So you can feel a little bit of sense of achievement. Don't feel like, oh, this is a goal I can never achieve. But if you're thinking about breaking down small step by step, and you can regain a sense of achievement. Okay. Exercise. And so evidence has shown that gentle exercise can reduce fatigue. Ideally, should aim for 30 minutes 5 times a week, but we all know it's quite difficult to achieve, even myself. But you can thinking about start with 5 to 10 minutes a day and gradually increase. And exercise doesn't mean that you have to go to the gym, you have to do the jogging or have to do the swimming. It can just be being active, doing the things you enjoy, cycling, gardening, anything you enjoy, keep active. Sleep hygiene is also important as part of the fatigue management. So there are some tips and to maintain good sleep hygiene. Having a regular bedtime routine, so to have a consistent bedtime and wake up times. Be more physically active during the day, and making sure your bedroom is not too hot, too cold, too much light, or too noisy. And dedicate your bedroom a space for sleep only, because sometimes if you bring your computers or bring your work, so your brain might relate it that this is not the space for sleep, but you might do some work. So if you could just try to dedicate your bedroom space for sleep only. And think about your stomach. Don't go to bed too hungry or too full, and avoid having too much drinks that contains caffeine or alcohol before you go to bed. And one thing we also need to bear in mind is try to limit your screen time before bed, so your brain to have a time to rest and have a proper rest. Okay. So next, we're going to talk about anxiety and stress management. So anxiety and stress are normal reactions to this challenging life event. So it's important to notice that what make you feel stressed or anxious. So there are some strategies that you can do to help managing your stress and anxiety. For example, talking to someone, this can be your family, friends, or any healthcare professional within your treating team, or if possible, you can ask your treating team to refer you to a psychological support services. Practicing mindfulness and relaxations, for example, deep breathing exercise or using the mindfulness apps like Headspace, Calm, or Healthy Mind programs that might help as well. And again, exercise and just maintain your hobbies and interests. Keeping a diary or journal is can be also helpful because these can help you to recognize the things that might trigger your anxiety and stress. And then you can discuss that with your healthcare professional or your treating team. And complementary therapies can also consider, for example, yoga, meditation, or massage. Some hospitals probably will offer complementary therapy services. Again, you can speak to your treatment team, you can refer to them. Okay. Okay, so I'm just gonna introduce a very simple relaxation exercise. It's called calming hands. Some of you might hear that already. So calming hand is a simple relaxation exercise that you can do when you start feeling a bit anxious or stressed. And it can give you a little tools to make you feel more in control of what's happening and then try to distract your mind. So you start with your thumb, take it firmly, and then recognize that what's happening. So, okay, you are feeling stressed, you recognize that. And then you move on to the next finger and give yourself to do a side out, gentle breathe out. And then you move on to the next finger to inhale gently, breathing into your nose. And then you move on to the next finger, breathe out again, as long as possible. And then finally move on to the little finger. Stretch your hands and relax. Just give yourself a little pause here. You can repeat the cycle again and again if you find that quite useful, if that improves little by little. So this is quite a simple relaxation technique that you can use. Okay, so this is my last slide. So I just wanted to address that you are not alone here. Fatigue is very common during or after cancer treatment, even before diagnosis. It's not a matter of putting yourself through it or just getting on with it. It's about managing the fatigue rather than cure it immediately. It's important to try and do things for yourself because if you don't use it, you don't do it, and you will lose it. Fatigue management will take time to practice, and and your energy goes quite quickly, but only comes back gradually with the daily practice. Okay. Thank you for your listening. That's the end of my presentations. I am going to unshare my screen.
Oh, thank you so much, Regine. That was brilliant. That was really interesting and helpful. So we've got plenty of time for any questions now. Not just questions, if you want to share your experiences, if you've tried any of the techniques or any of the things that Regine talked about and found them particularly helpful, then please do to share it with everyone else. So to ask a question, if you can click the raise hand icon at the bottom of your screen, or you can write the question in the chat box and I can read them out for you. Yeah, that would be great. We've got plenty of time. Oh, Terry, I can see you waving your hand.
Okay, can you hear me?
Yes, I can.
Okay, right. I'm in a situation where I'm about to go into the start of treatment, had a good run. About sleep management, I always try to get up at 7 o'clock in the morning, even though sometimes I don't feel like it, because I know that after lunch I will need to nap. Would it help if I got up later in the morning?
Regine,
Okay.
do you want to? Did you hear that? We cut out a little bit
It cut out a
during.
little bit, and you say you're trying to do a round and usually wake up 7 a.m. and
Yes,
then you take a nap around lunchtime.
yes. Part of the reason for me getting up at 7 is, well, that's the best time of the day, the morning, but I know that I'm going to nap in the afternoon. So I feel that I've got to try and get up as early as I can to get something out of the day. Would it help in terms of my plan if I got up later, maybe 8 o'clock or 9 o'clock or something?
I would say it's really think about what time of the day works better for you. If you feel like if you wake up early and then
Yeah.
you feel more energy, and then just stick to that. But if you feel that if you delay for 2 hours and you have more energy, I think it's really to work around what works better for you. And it's okay to take a nap, but I think it's more about how you're gonna facilitate a good rest. Because I think sometimes taking a nap, you might end up sleep for another 2, 3 hours, just to make sure and you are taking a nap, it's not too long, but you do have a good quality rest. But it's okay to take a nap if you're not going to disturb your sleep patterns in the evening.
Thanks, Regine. Christine, you've got your hand up.
Yeah, sorry. With being anemic, so my levels run between 95 and 105. My physician doesn't want to treat me because I also have both alleles for hemochromatosis, which we have in the family, and I think he's worried about setting that off. So I'm just running at a low hemoglobin rate. Is this something you're familiar with yourself? Have you come across with the two things together, hemochromatosis and WM, and how it's managed?
Regine, do you want me to take that way?
Yes,
Yeah.
please.
To be honest, no, it's not something with WM I've come across with the hemochromatosis as well. Yeah, that is more difficult for you then because they can't just give you, blood transfusion or iron infusion because it makes things more complicated. So I think it's just trying to use some of the techniques that Regine suggested for managing your fatigue, more generally rather than medically, if that makes sense.
Yeah. Okay. Thanks.
Brian, you've got your hand up. Do you want to ask a question? Oh, you're still on mute, Brian. Sorry. Still on mute. I can't hear you yet. If you just tap the... Oh, that's it. You seem to be off mute.
Hello?
Oh, yes, we can hear you now. Go ahead.
Oh, hello.
I don't know.
Sorry, oh,
We can hear you, Brian. You can go ahead and
oh,
ask your
right,
question.
okay, thank you. I'm currently on watch and wait, and I'm wondering if I move on to treatment eventually. I don't know if I will or when I will. Will the treatment improve my fatigue and tiredness? Is that what the treatment partly is about?
Regine, do you want me to take that one as well? um, so it, so if your fatigue is related to anemia, which means that your WM cells are crowding out the healthy red blood cells in your bone marrow,
Yes,
then treatment will help with it in that way because it'll dampen down the number of WM cells, and then your red blood cells can replicate properly, and hopefully the anemia will resolve then. So treatment can help with it in that way. Obviously, like Regine said, treatment can bring fatigue on its own, unfortunately. But that can should resolve after you finish treatment. It can take a few months, sometimes longer for some people. But yeah, fatigue is one of the reasons, if it's related to anemia and things to do with the WM, is often one of the reasons why treatment is started and should in the long term help with that then. Does that
yeah,
answer your question?
yeah, thank you. That's
Oh,
helpful.
good.
Thank you.
Okay.
And also, I think everyone will have a different reaction with the treatment. And then some might not feeling fatigue at all. And then some might feel fatigue immediately after the treatment. Some might be feeling fatigue after they finish the treatment regimen for like after a few months. So I think everyone is quite different.
Yeah, that is true. Yeah, we often talk about fatigue and treatment, but some people don't experience that at all. That is true. Carol, you've got your hand up. Would you like to ask a question?
Hi, yeah. I finished treatment the 1st of October, and I've been left with neuropathy, which is causing me to get very fatigued with the pain of it. I wondered if there was anything that I could do to help with that.
I think for the peripheral neuropathy, I think you probably need to discuss with your treatment teams and to see if they can treat the symptoms. And because like I say, I think with the pain, sometimes you can exacerbate the fatigue symptoms. But if
Yeah,
we know
absolutely.
the cause, your pain is come from the peripheral neuropathy, but do speak to your treatment team to see if they can prescribe you to any neuropathic pain relief, things like that. If you can reduce the pain level, and then probably that would less affecting on you doing other things. But do speak to your treatment team.
Okay, thank you.
Okay, any more questions? We've got plenty of time. Or, like I say, any experiences people have with managing their fatigue, if it was something they found particularly helpful. Pat, you've got your hand up. Oh, you're on mute, Pat.
Yes, it's not a question. I'm just saying that I've been doing the IWMF yoga for several years now on a Monday evening. It's a Zoom thing for America for WM patients. And I find I don't know if it helps with my fatigue, but because I don't do much exercise, doing yoga helps my body feel a lot better. I always feel a lot better after it. So I can say I can recommend it for people. And it's also nice to have a sort of community to chat with other WM patients that you know you're not alone. So I just thought I'd recommend that.
Oh, that's great, Pat. Thank you. Yeah, I think I often recommend that because it's quite a gentle exercise.
Yeah,
And it's quite good for if, part of your fatigue is maybe some anxiety or, some mental health things as well, then yoga is quite good for that, I find. So
yes,
yeah, that's great. Thank you, Pat.
And also, I think it's a way to keep you active as well.
yes, absolutely.
Okay, any other questions?
I've got one more, if I may.
Yeah, go for it, Terry.
Okay. I've now been recommended to have treatment soon, either DRC or BTK. Could you tell me roughly what the difference is between those, please?
Yeah, so DRC is chemotherapy and immunotherapy. So the rituximab is the immunotherapy, and that's more targeted treatment that targets B cells and WM cells. And cyclophosphamide then together with that is a type of chemotherapy, which targets general rapidly dividing cells. And that's a treatment where you have a dose every 3 weeks. You have gaps in between treatment, but it's for a fixed duration, so it's for a few months. And then the BTK tablet is again a more targeted treatment, and that is not a fixed duration treatment. So once you start on that tablet, you stay on it until either it stops working or you start getting lots of side effects and you're not tolerating it. So yeah, that's the main difference between them.
So the BTK is almost for life then, is it?
Yeah, it's for as long as it works for you, basically, yeah.
But there's some issues of its availability on the National Health, I think, isn't it, the NHS?
There's different types. So there's one called zanubrutinib, which is available if you've already had some treatment. It's not available first line, or if you've never had any treatment before. Ibrutinib is another type which is available first line but only through a trial.
Okay.
That's
Right.
okay.
Thank you for that. Thank you.
That's okay, Terry. So we've got 2 comments in the chat. Val says that she finds Tai Chi really helpful, especially to support balance. So that ties in with what we were saying about peripheral neuropathy as well, because sometimes that affects your balance. And Jessica says that she was advised to push through and do some exercise when feeling fatigued. Would you say this is the right thing to do during a chronic episode, or whether to rest? What would you say, Regine?
I would say just thinking about being active or exercise, because I think every day will be different. I think it's still good to keep a minimum level. For example, if you feel like today is your worst day, and maybe still kind of do like a minimum like 5 minutes activities or 10 minutes activities. It's quite important to keep active. Instead of even you're really tired, you still have to think about, okay, I have to complete the 30 minutes of exercise because of the recommendation. I think it's all about how you can keep yourself active, but on those really tired days, what would be the minimum activities that you can do and that can still keep you doing things? Or it can be just something that you really enjoy doing. You don't have to be thinking about, I have to complete the 30 minutes. It's just about balancing. So on the good days, you may be able to do 30 minutes. On the bad days, maybe you can do like 10, 15 minutes. So it's just about balancing through. Does that make sense?
Thanks, Regine. Yeah, great. Peter says, my husband is on zanubrutinib and is absolutely exhausted all the time. Is some of this due to the medication? Zanubrutinib so all treatments can cause fatigue as well, but it could also be down to the WM. So it's worth letting your hospital team know if he's really exhausted and not able to do the sorts of things that he usually does. Because they can see whether is that the right medication for him, is there something they can do about that. So it's worth talking to your hospital team. I don't know if Regine, you've got anything to add to that.
I know some of my patients, when they start a new medication, or sometimes the medical team will probably reduce the dose to see if that improve and then go back up again. So I'd agree with maybe something that discuss with your hospital team if the treatment side effect is too strong and affecting so many different things. It's worth discussing about that.
Yeah, thanks, Regine. Okay, any other questions? Pat, you've still got your hand up. I don't know if that's just, no, it's just from before. That's okay. I didn't want to be ignoring you if you wanted to ask another question or add anything else.
Could I be very forward and ask each person to give their age, except for you two, of course? Because it looks as if, you know, we're fairly senior and we've survived this long there. So I'd be really interested to know what people's ages are, but I understand that's personal. I'm 79, by the way.
If people are happy to share that, they can write it in the chat box as well. But yeah, I think WM mostly affects you know, people who are sort of 69 and over, 65 and over.
78.
Maybe how long?
75.
71.
64.
66.
74.
72.
I'm 74.
80.
79.
Oh, snap.
Yes.
A few people in the chat.
80 next year.
Okay,
I'm
Andy,
79 and a half.
79.
Other 79.
Can I join the WM?
So someone that has popped in the chat saying that they are also on zanubrutinib and were also exhausted for the first 4 months. But that was due to having low platelets. And then they did feel an improvement and are now really well after 12 weeks. So that's good to hear that it might just be a case of
persevere.
Yeah.
Okay, yeah, great.
That's the right word.
I'm on a Zoom thing for WM.
So any other questions about fatigue? Any other questions for Regine? Or as I say, any other experiences, anything other than yoga or Tai Chi that people have found really helpful?
Going to sleep.
Jane, you've got your hand up.
Yeah, it's more a comment, actually. I mean, I was diagnosed because of the fatigue. I went to my doctor and said, this is absolutely not normal. He ran a series of tests and they found what the problem was. And I'd always understood that fatigue was actually worse with WM than with other forms of cancer because it exactly sort of induces fatigue because, you know, of the part of the body that's affected. Would you say that's the case?
I don't know if it's worse than other types of cancer. I think that's a very subjective thing, and it depends on, you know, lots of other factors, however many other health conditions you have, what kind of treatment you have, and things like that. But I definitely think it's true that it's an inherent part of the WM because I've heard Dr. Desar describe it as, you know, because we can't, obviously we can control the WM and we can treat it, but we can't unfortunately get rid of it completely. So I think there's always an element of it working in the background and taking up a bit of the body's energy. So I think even when, unfortunately, when it is under control and your treatment's working, it can still be draining your body's energy in that way. Christine, you've got your hand up.
I was just going to say, I live in a townhouse and our bedroom is 55. I've got 55 steps. And the older I get, the more forgetful I get. It's just natural exercise because I'm doing that 55 steps up several times a day, which I think probably just generally helps as background exercise. So I think sometimes we're doing exercise without really realizing it, how much we're actually doing.
Yeah, thank you, Christine.
Good sharing. I think it's quite good to think about because when we talk about exercise, I think everyone's mind probably I have to do this, I have to go to the gym, I have to do the jogging. But sometimes keep being active, like if you're doing a lot of stairs during the days, or you have your gardens, front garden, back gardens, or even go for a small walk, that will consider your exercise as well.
Thanks, Regine. So Greg has said that after 2 cycles of DRC, he went on to ibrutinib and it worked in 6 weeks. So that's good to hear. Carol said she's very fatigued, but she finds it difficult to sleep. Is that normal?
Yeah, I think, like I say, sleep disturbance, I think is one of quite a lot of problems that the patient mentioned about that. And it's just because I think during the day, you just feel like you're really tired, but you don't have a good rest. And then overnight, it can cause some sleep disturbance. But I think it's quite important to think about, is there any other underlying conditions? It could be anxiety or stress, because your brains can't stop thinking about, I'm so tired, what's going on with me, I'm so tired. And I think it's good to speak with your healthcare professionals or your treating team to see if there's any underlying condition that can be treated or resolved.
Yeah, thanks, Regine. Simone in the chat says that she finds using Headspace for mindfulness really helpful and to help her fall asleep at night. So that's good. Yeah, I've heard a few people say that that's really helpful. Greg says the Sleepio app is also really good for helping you sleep. So Michelle says it's been 4.5 years since she was treated, and over the last 8 months, she now gets one severe migraine every week. Is this related to WM progression? My consultant doesn't answer the question. Headaches can be related to WM, especially if your paraprotein level is very high. You can get something called hyperviscosity syndrome, where your blood becomes very thick, and that can cause you to experience headaches. Perhaps if your consultant isn't answering your question, I don't know if you've got a specialist nurse that you could contact and ask that question of as well, because they can see your blood results and see your medical history and things, and might be able to answer the question for you as well. Or you could go to your GP. I know GPs aren't specialists in WM, but they can investigate other causes of the migraines. Kat says, I've recently started acupuncture to address peripheral neuropathy, and that seems to have helped my quality of sleep. So Regine did mention complementary therapies.
Yeah, I know some hospital, they have acupuncture service between them. And I know like Marsden, we do have acupuncture services, and then some of our patients being referred to them, and they feel like either peripheral neuropathy or fatigue symptoms has improved. But I think again, you need to speak to your medical team is appropriate, because sometimes Eastern acupuncture and Western acupuncture work slightly differently.
Oh, okay, I didn't know that. Yeah, the hospital I used to work at offered reflexology, which people found really, really good for relaxation. But yeah, like Regine says, check with your hospital team before you start any complementary therapies. Any other questions? Oh, Anne, I can see you waving your hand there.
What I'd like to ask is, I've also got Bing Nils as well as WM, and I was diagnosed at 59, not in the same way as everyone else. I had a massive seizure. So I didn't know that they would treat me for encephalitis. But anyhow, from there, since I've had all my treatment, I walk with a walking group, which really helps. But I've also, in my feet, get terrible neuropathy at night time though, not during the day. And I wonder if with the Bing Nils with the WM, if that's part of it.
Of causing the peripheral neuropathy.
Yeah.
Yeah, it can, because it affects the nerves, the Bing Nil and the Waldenstroms. It can cause peripheral neuropathy. Yeah, definitely. So yeah, if it's stopping you from sleeping at night, like Regine said, it's worth speaking to your hospital team to see if there's anything they can do to help that, any medications. Although, having said that, some of the pain relief that they use for peripheral neuropathy can also unfortunately cause fatigue. So it's worth, if you do start taking medication for it, just keep in touch with the hospital team, let them know if that's increasing your fatigue. Sometimes they need to get a balance of doses and play around.
Yeah, because I'm epileptic as well, so there's certain things I can't have either. So
it's even more complicated for you than than everyone else. That's really tough.
Yeah. Thank you.
Maria's asking, do we recommend any vitamins, etc., when we start treatment? So we've actually, our next webinar is with a dietitian who will be able to talk about diet and nutrition and vitamins and things. But I would say there aren't any specific vitamins that we recommend taking. If you are going to take any over-the-counter medication or supplements or anything like that, check with your hospital team. Be really careful when you're on chemotherapy, because it's surprising what seems sort of like benign, Hollands and Barrett tablets can actually have a lot of interactions with many tablets. So it's really important to be really careful before you take anything over the counter, and just check with your pharmacist at the hospital. But yeah, there aren't any sort of specific vitamins that we recommend taking with treatment. Any other questions about fatigue, or anyone else's experiences they want to share of how they've managed their fatigue, what they found helpful? Keith, you've got your hand up. Oh, you're still on mute, Keith. Sorry.
Sorry, Beth. What it is with fatigue with myself, I can't sit and read a paper at all. If I pick a paper up and sit down, I've gone within 30, 40 seconds. I just go, and it takes me ages to read a paper if I put it down in the end. But one of my main problems is I get a lot of bone pain. I've had spinal fractures, which just come out of the blue, and I'm suffering with fingers locking all the night, every night, and most of the day. So if I tried all the paper,
you can go to bed.
Sorry.
Sorry.
So basically, I was just saying, is anybody else suffering with that sort of bone pain? Have they experienced fractures? Just cover, I'm still on active monitoring, but quite high levels of paraprotein, but at the moment they don't want to do anything with chemo or anything.
Oh, thanks, Keith. Has anyone got anything to answer to that? Have they had any experiences with anything that Keith described? Oh, someone in the chat, Jim, said he's had 2 spinal fractures as well. No explanation. Also, oh, sorry, Brian, did you want to ask?
Yeah, just to pick on what Keith has just said, I find that out of the blue, my fingers do lock as well at different times during the day, as they just go into a spasm and I can't straighten them out straight away. It's just not, it's not hugely painful. It's just awkward.
Yeah, I know the WM can cause joint pains, especially in cold weather. So whether it's related to that, worth talking to your hospital team about that. Philip, you've got your hand up.
Yeah, well, I can relate to Keith about reading, and and I find if I pick a book up when I go to bed, I can just about manage 2 pages and I'm off like a light. So it helps me go to sleep at night, just reading a book. And then in the morning, I do wake up with sort of my hands sometimes feeling like sausages, that and I have to sort of exercise them until they get going again. But that's the only pain I've had with my hands. I just feel, they don't belong to me sometimes in the morning. I guess that's something to do with WM or just the way I sleep. I don't know. And the other thing I've found out from a recent blood test at the doctor's is I'm borderline diabetic. My HbA1c C or whatever is quite high. How does that relate to WM? Is it something comes along with it, or is it a completely different problem?
I haven't heard of there being a correlation with diabetes and WM, except in people who've had steroids as part of their treatment. That can cause diabetes. I don't know if you've ever had steroids with any of your.
I've had no
You haven't been treatment
I'm,
yet, no.
I'm just on watch and wait like a lot of other people.
Okay.
And,
yeah, sometimes the steroids can cause it. Usually finishes after treatment, but rarely it can. It's continues even after treatment. But yeah, otherwise I haven't heard of it. The two being related.
I mean, apart from that, I mean, the things that Regine was saying, the exercise and hobbies and walking, gardening, I do all that, and that I don't have a problem with it, but I tend to be better in the morning, and you know, the batteries run down as you were saying towards the evening, so I suppose that's quite normal.
I think it's really think about when we talk about the planning and prioritization, you really think about what's important for you to do during the day, and then also think about something that is really enjoyable, and then prioritize your energy doing the things you really enjoyed. Otherwise, if you feel like something you really enjoy and then you do it when your batteries start winding down, and if you feel like quite frustrated, I can't enjoy the things I can do anymore. So it's more about rejuggling things. Think about which day of the week or what time of the day works better for you, and then you can just fit that in to prioritize that.
Yeah, okay, thank you.
I was going to say as well, like Regine said in her presentation, other conditions than WM obviously can cause fatigue, and diabetes is one of them. So if your blood sugar was high, that can make you feel very tired as well. So.
Well, I am anemic as well.
Oh, okay. Oh, yeah. You've got a few things there, unfortunately.
Yeah.
In the chat, Susan said that she finds keeping her arms, hands, legs, and feet really warm with extra layers, including warmers, really helps, particularly at night. She uses an electric blanket, I think, for peripheral neuropathy. Then going back to what we were talking about with that, quite a few people saying they also experience bone pain with a WM. We've got.
I think it's quite important. Yeah, sorry. I think a lot of you kind of mentioned about some different symptoms apart from fatigue. I think it's quite important you just take a note of any new symptoms you experience, and then put that in a diary, because sometimes when you go to see, maybe sometimes when you use your next appointment, you probably just forget what happens. But with the diary, kind of can prompt you, actually, this is a new symptom happening recently, and then do discuss to your medical teams, and then that happens. So just write it down, because sometimes fatigue can make you just forget about things or not remember things. Just keep a diary. If any new symptoms, any unusual things happening around you, and it kind of persists for so many days, weeks, or months, do let your medical team knows, and then they can maybe do a little bit additional investigation to find out what's the causes.
Yeah, thanks, Regine. That's a really good point. So it's nearly 8 o'clock now, so Regine's got to be up early for work again in the morning, so we'll let her go and have her tea now. But thank you everyone for coming, and a massive thank you to Regine for giving up her time to come and talk to us and help us. So if anyone would like to come to our next webinar, which is on October the 29th, that's with a dietitian, as I say, on nutrition and diet and WM. The link is on our website, so feel free to sign up to that. Should be really interesting as well. But obviously, in the meantime, you can contact me on the support line by phone or by email. The details are on the website as well. And otherwise, we'll see you soon.
Thank you.
Take care. Ta-ra, everyone.
Thank you.
Thank you.
Thank you.
Bye.
Thank you very much. Thank you.
Bye.
Thank you, Beth and Regine.
You're welcome. Ta-ra.
Thank you.
Bye.
Want the
Bye,
camera
Beth.
working, please?